when Dr. Ayush asked me about speaking about my journey, it actually brought some painful memories, but it's a tremendously long journey. And I was wondering, how much time do I have, and do I have to relive this pain? Well, I can tell you, it's been a very long journey, traveling through numerous places, numerous continents, 6 universities, to get to where I am today. But having said that, I would not give back one single day. Where I am today, I could never have achieved it if I had not stayed the course that I kept. But maybe it's something I can pass to each one of you, is what it took to get here, and how, if anything, you can get here. And I think every one of you honestly can. There's nothing special. Every one of you, you put the effort to it, can. I think part of it, I just told you the journey where, yes, I'm TNMC Medical School, Nair Hospital Orthopedic Residency, all the way up to a lecturer. But along the way, though, there are many things I always say. We all grow up and stand on the shoulders of the great. There are always great people we owe our life to. And I wouldn't be here if it was not for many people along my life. But that's my journey in short, you can see, and I want to expand on that. Yes, from India, I went to England. I was Royal Liverpool University Hospital, spent 3.5 years in the Liverpool rotation. Then went to the US, spent many years hospital special surgery, and ultimately came to Beverly Hills Cedars-Sinai Medical Center, where I've been there for the past 23 years or so. But if you go through the history, like I said, there are many people that affected my life or influenced my life over the years. A lot has been written about me, so you can always cross-check this. And there are 2 articles that have been written about me that I'll highlight it, that probably you're welcome to Google and read it. I think it's worth reading. I even give my kids this because it really explains a lot that we had to go through to get to where I am today. And I have no qualm about sharing it, and I have no shame about it. So this was one in 2009, and then another one was in 2020. I'm not particularly fond of the title, but it is what it is. And these are 2 articles that I think I refer you to. But I'm going to talk predominantly from it. It is the story of my life, and I can always say it is what it is. But none of this could have happened without this single human being. I'm going to single him out more than anybody else. Many of you know him, Dr. Dilip Tanna. He single-handedly, I can tell you, 90% made me today who I am. There were no second guesses. There was no chance of you not knowing something. When I was his registrar, you better knew every single thing on every single patient. If you didn't know, I promise you, you would be embarrassed in front of 100 people, and it make you feel like absolute shit. It was Socratic thinking. It was that sort of teaching. Today, you couldn't do this today. Today, you cannot even teach somebody in this manner. We live in this woke society where you cannot even ask somebody a question today. But to me, I benefited significantly from this. So much so you had to go back and know everything. It was a challenge that I'm going to show next round that I know everything. So you had to go and read and get back. And at that time, yeah, of course I was coaching. But today, when I think back, he made me today who I am, made me go way ahead and read and get on top of things and analyze, find solutions, get to the bottom of problems, and know what needs to be done, and not just look around and say, I don't know. I don't know was not an answer he would ever accept. It didn't matter what it was. You had to know the answer. And it was our job to find out what that was. So I literally owe him a lot, and I want to single him out in many ways. But we also very fortunate at Nair at that time to have people like Vinod Larry. Many of you know him. This man was the most fearless surgeon I've ever seen. I don't know how many of you know, we were doing pedicle screws in 1984 in Bombay, way before Art Steffi did his screw in the United States. We were doing pedicles, went to the cadaver lab and learned to put pedicle screws. We were doing C1, C2 harms fusions in 1985. Dr. Goyal wrote his paper way later. We know Larry had already done it. This man was fearless. He taught us what to do. We trained, we learned, and we learned so many things from him that today it stays with me throughout life. And this came from Bombay. This came from these guys who learned what to do in the worst of circumstances, made do with what we had, made local instruments made across the street. I can even name it. Uma Surgical was this place across the street. We would literally go and have them make screws for us and then go and use it. It was a different time, a different era, but it gave the confidence that we could to go and do things, gave us an impetus that nothing is impossible. And I have to, again, really give him a lot of credit for giving the courage to do surgery. When I think back, think out of the box, do things you cannot do, find a way to solve the problem and get it done. Take care of the patient and do things. And he was phenomenal for that. So I went all the way as registrar, all the way to a lecturer. And then as things would have it, as you guys know, I was transferred to KEM Hospital at that time as a lecturer. And I got to meet Shekhar Bojraj. Shekhar was very young. He was just an attending at that point. But he was actually a great influence in my life. Brilliant man. I probably spent about 3 to maybe 6 months at KEM, but I missed Nair so much, I wanted to go back. And we probably did the first ever transfer between a lecturer who was from KEM with Dr. Tanna at Nair, me from Nair in KEM with Bojraj, and we did a swap. And we swapped back, and I went back to Nair with Tanna. But Shekhar taught me a lot about taking care of patients, thinking clearly, take care of who the patient is. And he also gave me a lot of advice down the line when I went back to England. I'll come to that in a minute, but I do want to thank him. And we've been great friends, obviously, a lot of influence from what I've come from years ago. And it's shocking to think that it was 35 years ago. But these are people. But in England, my life changed dramatically. I think what happened in England was realized we had so much experience in India. When I went to England, I made it my thesis to do pedicle screws. So my thesis for my master's for the MCH auth was pedicle screw fixation. And actually pedicle screws is still a novelty in England in 1990 and 1991. We were still doing hooks and things like that. And Harry Luque was more predominant at that point. And pedicle screws already, we had so much experience. So I decided to make that my thesis. And actually, Roy Camille was my mentor, believe it or not, because nobody was there at that time who could be. And Roy Camille was. I spent a good 6 weeks with him and one of the greatest experiences of my life. And then went down to Marseille, thanks to Shekhar Bojraj, who told me, you got to go to René Louis and Marseille and spend some time with him. And that's why I bring back Shekhar. It wasn't for Shekhar, I would not have met René Louis, who probably was the greatest anatomist of all time. I have never seen a human being explain to me in surgery and anatomically every single structure. I've never seen the hypogastric plexus except from his hands. He showed it to me. And he actually could see it, feel it. He was an unbelievable anatomist. Great book he has. And interestingly enough, with so much on social media today, I couldn't find a picture of him. I'm actually embarrassed. I could not find a picture of him on the internet. It tells you how old I am. I'm pre-internet days. This was 1991. There is no picture of him on the internet, which is kind of sad. Maybe I missed it. I looked for it. But this was a big influence in my life. In 92, I did my master's. And after my master's, we decided to come to the US. And literally in the US, there was not a single job for an orthopedic surgeon. Don't forget, this is the 90s. Impossible to come to the US. I left a $120,000 euro job to take a $20,000 research job in Florida. The only thing I did not know was TSRH. So I wanted to get back to TSRH and work with the guys in Florida, University of Gainesville, and work with them to know more about that. They are the guys who discovered a lot of it. It was Chet Sutler and Gary Lowry at University of South Florida in Gainesville. I took a $20,000 research job only to find out I could not work there unless I have a license. And I've done a residency in the United States. There is no way I can continue working there. At the same time, though, I applied for a fellowship and managed to get a fellowship at Hospital of Special Surgery with actually David Levine, who was the founder of the SRS. and did a scoliosis fellowship and went to HSS to do the fellowship with David Levine. But it so turned out that I was David Levine's last fellow and Ohana Bawachi's first fellow at HSS. This was a life-changing thing for me in my life and career-changing. You had someone so senior as David Levine with scoliosis, who taught me a lot about care of children and scoliosis. And then you meet Bawachi, who is the next most fearless man I've ever seen. This man can operate anything he saw. An unbelievable surgeon. There was no no in his life. There was no impossible in his life. There was nothing. There was not a possibility. And he would do it, and he had supreme confidence of not only doing it, but executing it. And what I really learned from him is anything is possible. You set your mind to it, you plan it, you can do it. The most difficult surgeries we ever undertook, he would do it. The next biggest thing I learned from him was nobody is white. He told me a story about Twin City scoliosis where he was there, and he would have Bob Winter and Ogilvy and John Moe and everybody. And he told me everyone did the surgery their own way. They were all different. Each one of them did it in their own way. And he taught me that, he learned it doesn't matter how you do it, as long as you do it in the way you're most comfortable with and you're confident doing it. There is not one right way. And he was talking of the 4 biggest scoliosis surgeons in the world that we revere. And here was this gentleman doing his own thing, learned from all of them, and hit his way. But it was perfection. It was perfection along the way. So it's not about one way, but you take the best from everybody and you then make it your best. It's something that I really learned from Bawachi, and he's been a mentor all my life. It taught me a lot about surgical care and what do you take from one place to another. And this is where the story becomes interesting. I realize at this point now, if I want to stay in the United States, I got to do an orthopedic residency. And this goes back to the articles written about me. And this is a true story. And I'm not ashamed to say it anymore. I used to before. Applied to every single orthopedic program. Probably there are about 150 programs. I don't even know how many. Every single one of them. Did not get a single reply from a single program. Don't forget, I've already done 13 years of orthopedics by then and probably have 5 postgraduate degrees. It didn't matter. Not one reply, not one. The year goes by, not even a thank you for receiving my application. 0. So year goes by, I don't know what I'm going to do. Here I am at HSS, an opening opens up, and David Helfet, who was the chief of trauma at that time at HSS, had an opening. And this again changed my life. David said, do you really like me to come and do a fellowship? I said, sure, I got nothing else to do. I said, all right, I did his fellowship. He was a pelvic and acetabular surgeon, of the greatest surgeons I ever know. And he got me into his fellowship. Here I'm doing his fellowship. And what I learned from him, the ability to think 3D. When we did pelvic and acetabular fractures, he would not give you anything but an AP X-ray, and that is it. And maybe some oblique views. Not only did I have to plan the fracture out of a both column acetabular or pelvic fracture, I had to draw it on a pelvic model. And I had to plan every single screw that I would put in. And if I got it wrong, I wasn't operating. It did not happen. It really made you think on a 3D dimension of what you're going to do in the OR, where you had to know in your head. And today, to this day in spine, that matters. An MRI is not there in the OR. You still have to know where to put that screw in. You got to have a 3D knowledge of what you're doing to get to that. And I really owe it to Dr. Alfred for what he taught me there. And again, it was attention to detail, taking care of patients, take care of the patient first. Do not look at x-rays, look at the patient. Say no when you need to say no. He was a master surgeon, but also a master physician. And he knew what to do at the right time. Anyway, applied again, strong story short. Again, no reply. 150 programs, not a single reply. We usually apply in August, September. Come October, November, no reply. I was obviously getting pretty frustrated. David sort of knew it, Dr. Alfred, and he called me in and I sat inside him. I said, Dr. Alfred, I don't know what is going on here. And I literally looked him in the eye and I told him, if you really feel I don't deserve a residency, not residency, don't deserve an interview, not even residency. I don't deserve an interview. I'll get up and walk out. but I think I should at least get an interview. You tell me, what do you think? He was so shocked. He literally picked up the phone, made 5 phone calls, got all 5 interviews, matched in every single program. And honest to God, that's how I got an orthopedic residency in the United States of America. I would have never got a residency if he had not made that phone call. He knows it. And I've told him that very clearly. And honestly, all 5 got a residency, Albert Einstein in New York. Now I got an orthopedic residency. Here I am doing my orthopedic residency. And ultimately, I've done so much spine by that time. That was a really humbling process. Here I'm coming to an orthopedic residency post Bawachi and Arthur Helford Fellowship. And I'm doing a residency. By the end of the day, you're still a resident. You play your part. I did every single day of that. This is my 3rd orthopedic residency after India, England, and now the US. Anyway, did that. My director was great there. Literally told me, Neel, please do not do another spine fellowship. We all knew in one spine. Everyone knew I like spine. He said, just go find a spine place for yourself. We'll write it off as your spine rotation. And then I went to Texas back, and it was an amazing association with these 3 guys. The reason I went was John Regan was doing endoscopic spine surgery then. It probably was the only thing I wasn't exposed to. So endoscopic spine surgery. Got to really know all 3 of them. Rick Garr was a master physician, master diagnostician, a master surgeon. It was really good to see how we handled patients, how we would assess that was phenomenal. And Steve Oxler, oh my God, the best business mind you'll ever find in spine surgery. He taught me a lot about the business side of spine, investments, industry, how they run. And to this day, all 3 of them are close family friends. They were at my wedding. They're all really good. I know their family, I know them well, their wives, very good friends to this day. And it's amazing for me to call them friends, but they mentored me a lot in my life. The other thing that Texas Back taught me is you do not have to be an academic institution to publish. And it was something that's phenomenal. Collect your data. Anything you do, collect your data. You can pick it up, you can analyze it, you can publish it. You do not need to be a major academic institution to publish what you can. And that stayed with me a long time and really worked well for me. And then I come to LA. They were opening a spine center, lucky enough to get a job there. And that changed me a lot because I met a lot of neurosurgeons. And neurosurgery literally changed and paved the path for me to develop minimally invasive surgery. That's what actually led to me. Don't forget, this is 1999 now, when ortho and neuro were still not really talking to each other. And I see the neurosurgeons doing amazing work with the microscope, with things and other things they were doing, the microscopic techniques, dural techniques, dural repair. Today, it's all common. We picked all that up. It changed my knowledge, knew how to do MI surgery, really moved me into MI surgery. We probably were the first one to do cement augmentation, at least in LA way back in 2001, 2002. Then led to the paraspinal approach, which we developed. We published a lot on that. Led to posterior non-fusion surgery, minimally invasive TLIFs. We published our first paper 2005. A lot of these developments came from there. I was involved in a lot of the FDID trials, very lucky to get into it, from Genesis to Stabilimax to other things. Many failed, some succeeded, but it led to a lot of minimally invasive approaches we developed for doing these things in a paraspinal way. The benefits of paraspinal approaches. We published all that sort of thing. Learned pedicle cannulation, fluoroscopic cannulation, the kyphoplasty or cement augmentation led to pedicle cannulation. So now we could do MIS pedicle screws way back from 2000. Endoscopic surgery, like we talked about. But the endoscopic surgery really led to the lateral surgery. It is that knowledge that helped us develop. I was the first to do a lateral procedure in LA, or probably the country, in terms of the United States. Lateral approaches, lateral MIS surgeries, started with trans-psoas and then moved on to pre-psoas. And today, all I do is pre-psoas, lateral surgeries, many of you know. Here are other things we got involved with, axial lift, which at that time was very attractive, a 5-1 minimally invasive solution. I talked a lot about it. We did it. I had the honor of teaching Bawachi to do it. Dr. Bawachi actually adopted it. He took on to it. The biggest honor of my life to teach him how to do it. But I think we quickly realized long-term that is not a good idea. It was not giving us lordosis. We were getting long-term failures. And actually, the first one, the biggest crow I ever ate, to go to the SRS and say it does not work. The company crashed in 45 days. It was fire sold, and never again have I done an action lift ever again. But I think you got to stand up. If you're going to say it, it doesn't work. There's nothing like follow up. And that's what I'll tell people, follow your patients. And what you thought was great, you'll be humbled. It did not work. And just be honest that it did not work and move on. It's okay. It's ours. And then came multi-level percutaneous instrumentation, which we helped develop, made all the instrumentation that came up. We were the first ones to do it, first ones to develop it, have all the patents on it. And eventually all these came together, the minimally invasive lateral fusion, along with multi-level percutaneous instrumentation, which today has led to, as many of you know, what I do is circumferential, minimally invasive surgery for adult spinal deformity. And today we've come a long way. I won't go into details of that, multiple protocols, multiple publications. And in terms of where we have come today, there's not a single deformity we cannot do as long as it's not fused. It's not the size of the curve. It's more about is it fused or not. And it's all done circumferentially, minimally invasively today without a single osteotomy. So it's come a very long way. It's a very, very humbling journey in many, many ways. Many people have taught me along the way, many, many things. I truly stand on the shoulders of the great. And it has been an unbelievable journey. But there are three things. The change is progress, but progress is change. And you have to. But to do that, though, there are only three things I'll tell the young surgeons out there. Never take no for an answer. There is no no. Find the solution. It is there. Think out of the box. You can't just keep getting scared and go down. Use your knowledge to think out of the box and find a solution. But the worst thing you can do, and I'm speaking specifically to Indian surgeons, and I see that a lot, please do not use racism when you fail. It is the beginning of an absolute disaster. That is you accepting defeat. That is not racism. Racism, or you think is racism, is based on ignorance. The person seeing you does not know how great you are. I don't care how many degrees you got. You may have 50 degrees from India and you come to the United States. Nobody knows. Nobody has any idea what these degrees mean. Your work is going to show how good you are, not how great you thought you were. So if you're ever going to make a transition across life, show how good you are, and your work will speak for itself, because each one of you are unbelievably trained, I will guarantee you, and you will get there. But you have to show you're good enough to get there. And if you sit back and say, oh, he doesn't like me, no, that's not true at all. Nobody's being racist. They just don't know you. They don't understand you. They don't know how good you are. You have to show that. And yeah, it took me 35 years. It doesn't happen overnight. It's a long journey. Stay the course, never give up, and every one of you will succeed. But it's a hard job. If you're going to get there, you can do it. I will not give one sing back from where I am, but think different and you will get where you are. Thank you.